Issues have emerged around COVID-19 and the management of COVID-19, and especially when it comes to seeking medical care for COVID-19. When you go to hospital, who pays the bill? Is it the government? Is it you? Is it your relatives? Is it NHIF? Is it your medical insurance? Who foots the bill? Is it all of them? Those questions have been asked, and those that have been unfortunate to actually get COVID-19 and require hospitalization have told us that you foot your bill, especially if you go to private facilities. Those that have gone to public facilities, and those are the main designated public facilities like the Mbagathi and the KU Teaching and Referral Hospital and the others in the counties, have said, well, I was there, I stayed for a while, and then I was let go. But initially, those especially at KU were complaining that they were having to pay, given a bill of 42,000 shillings because of just being accommodated for 14 days. As late as last week, or actually early this week, we also saw stories of people who are being given bills of 80,000 shillings and above in various government facilities around the country, in the counties. Who is paying this? We saw a story published by the Star last week, and we actually highlighted this story of somebody who was saying, I had medical cover, I have a medical card, I went and sought attention in public hospitals, I spent 24 hours seeking admission, with hospitals rejecting me. And eventually I had to cough out a huge sum of money to clear this bill. So why is it that we get to a point where it becomes your burden as well, and it's a global pandemic? The government is not helping you to foot this bill. Your insurance is abandoning you in this hour of need. NHIF, which is the public health insurance scheme, is abandoning you in this hour of need. It took the CEO to come and clarify that this is what we're going to do. We are going to cover some of these bills in public facilities, but not in private. Why are we getting to that point, City?
The question I would ask is precisely this. That is what we perceive as citizens who pay taxes, who have insurance cover, citizens who expect that other people ought to help us share the burden of health. But is that the perspective that the industry that we are speaking of share with us? Are they of the same view as us?
Who, the insurers?
Yes. The government's role in this is clear.
You're asking whether they have a heart like the rest of us?
No, I am asking what it is that determines the reasons they have for doing what they do. And in a situation such as this one, which is unique, completely unique, and unheard of before, what their role actually is. And this is the question that we must ask. And this one, sorry, Eric, we have to ask somebody who knows a little more.
We ask those that know.
Yes, not a little. In this case, ask somebody who knows a hell of a lot more than I do.
Okay. So let's bring in somebody who knows. His name is Harris Muiruri. Harris is the MD of Swiftlife Insurance. Good morning, Harris.
Good morning. Good morning, sir.
Thank you very much for speaking to us. Welcome to the Situation Room.
Yes.
You've heard our introduction, Harris, and we're saying, look, I go and take medical insurance cover when I'm well.
Yes. Yes.
As insurance for if I ever fall sick. This insurance cover shall sort me out at that hour of need. Now you are in a global hour of need where there is a killer.
Oh my God.
And you stand a chance of contracting this killer. And then you go to hospital, and that thing that you paid some premium for tells you that, you know what, this is not one of those hours of need. So what do you want us to call this, if not hour of need?
Wow. So what's your question?
My question is, we understand, so I'm not going to ask you whether insurance is covering for COVID-19. We already understand that private insurance is not covering for COVID-19, but let's just confirm, is this the case?
Let me first go a little. Can I explain?
By all means.
Give us the background, yes, and the context.
Now, we perhaps need to know what a pandemic is and why your insurance cover will not cover a pandemic.
Mm-hmm.
And even when you have your insurance policy, the insurance policy does not cover everything.
Yep.
If you read your policy document, it will tell you, we'll cover you to this limit, will not cover you for this, that, and the other. And so therefore, when the World Health Organization pronounced, I think it was in January, 30th January, the WHO Director General declared that we were having a global outbreak.
Yep.
And it was declared a pandemic. Now, most policies do not cover pandemics. However, when it came, the first communication that was out from the Insurance Association of Kenya, and I don't speak for them, I'm not their spokesman, but I'm saying what they said,
Yep.
is that this is not covered. Then thereafter, the regulator said that, please, can you cover this? Because this is a pandemic, you need to put in your weight.
So it did not instruct them, it requested.
When your regulator asks you, it's sort of an instruction, isn't it?
So you're sort of bound. Okay, go ahead.
But the truth of the matter, maybe can we just discuss first what is COVID? Because from an insurance point of view, first we look at a risk. What is a risk? And then you assess it and say, yes, we can cover this one and this one we can't cover.
Okay.
So first of all, the insurance companies already knew, or within the insurance industry, they knew we cannot cover pandemics because they are so wide and big in nature. Okay? Now, let's talk about how much it costs to cover a pandemic like COVID. Now, with what a government official, when I think the CS and his officials were in Kilifi, they did give the figures what it costs to be treated in a government hospital per day.
Yeah.
If you have this mild COVID or the symptoms, it costs 21,400 per day to treat you. And the average time you might spend being treated could be anything from 0 to 14 days. Now that means it costs about 299, 600. Just to round it off, let's say it's 300,000.
Yeah.
So if we say we have, like, I think as of yesterday we had about 19,600 cases.
Yep.
Let's put it, round it off for the sake of maths. 20,000 times 300,000. What does that come to?
It's very many zeros. Is that 6 billion or 600 million?
That's 6 billion, yes. Then you talk about if somebody has to be hospitalized and now they need support, oxygen, and so on.
Yep.
It costs 51,000 per day. If they're there for 14 days, it costs 714,000.
Yep.
Let's say if only 10% of the people get it.
Yep.
Out of the 19, so you're talking about out of the 20, you're talking of 2,000. Can you do the math what it is?
A lot more money.
Yeah, and now let's also talk about the budget. How much does the Ministry of Health, what is their budget this year? It's 111 billion, about 111 billion.
Yep.
The insurance industry together, the whole insurance industry, what they collect as premium in medical premiums,
Yep.
is about 40 billion. And last year, collectively, they made a loss of 1 billion shillings. As an industry, they did not make money. And when we talk about 40 billion, it means they are covering all diseases. Now, coming COVID, which will cost us, basically this is a health tsunami.
Yep.
That sweeps everybody on the path.
Yep.
And so therefore, the insurance industry looks at it and wonders, what do we do with this? So the first thing they did is said, we are not covering this. And then there was consultation, stakeholder consultation, and government said, look, you need to come in and we will help.
Yeah.
And that is where then they said, we will cover you when you go to a public facility. And what they do is they tell you, because public facilities don't take the insurance card, is you pay and then you seek reimbursement from us. We will pay for the reimbursement. Mm-hmm. Now, for private hospitals, those figures I was giving you are government figures.
Yeah, private is more
for
expensive.
For private facilities, it's much more expensive. Mm. So what I'm just saying, that this thing is bigger than even our own country.
So the bottom line is, even if you are feeling sufficiently philanthropic, the insurance industry would not be able to shoulder this burden. Because just from the figures that you've given us, we are actually talking about 7 billion shillings for covering just the people who have tested positive, if all of them
10%.
Went to government facilities.
A government facility.
And that's a lot of money.
And you know, by the time when this thing came along, we only had about 500 beds.
Yeah.
That could deal with the issue. So even when you have the money and everything, you go to the facility, you may not find a bed.
Yeah.
So what I'm basically saying, everybody is overwhelmed. The government, the insurance industry, the hospitals, the health professionals. This thing is a very serious thing. Mm. And we ought to take it very seriously.
Harris, if I may ask, has the insurance industry, well, they haven't, I mean, no one has ever faced the sort of situation we have with COVID, but has the insurance industry ever had illnesses that they probably, or conditions they previously have not covered, but which they've turned around and figured that they can at least find some way of helping their clients in covering at least, if not all the costs, part of the costs?
A good example is AIDS. When AIDS came, they never covered AIDS, if you remember, and you are well versed when it comes to AIDS. Mm. But today, they do cover AIDS. Now, we are in a situation where we are still learning what is this COVID, and we cannot assess what is COVID. How long are you going to be in hospital? How long is it going to be there? Because remember, insurance is about assessing risk. Now, you have a risk here that nobody understands. And truth be told, there's really no expert on COVID.
Yep.
People know bits and pieces of it. Mm. And so, therefore, truth be told, the insurance industry is trying to respond, because now you're finding one or two insurance companies saying, if you pay an additional premium, we'll cover you a little bit for the COVID. Mm-hmm. And so it's a case-by-case basis, because this is something which can actually drown not only the industry, but even our health sector. So that when government says to people, please stay home, please wear the mask, please wash your hands, all those protocols, is because I guess those people recognize that the seriousness of COVID-19. And I think us people, including myself, we, at the beginning, were very casual about it. When they were talking about lockdown and all those things, we thought, no, that wasn't necessary. I mean, this is something that can be dealt with. But this is a pandemic. Pandemic basically means this is a health tsunami that can clear our health budget, our total health budget. Mm. Let's talk about America. About 1% of Americans have it, isn't it? Mm-hmm. Assuming, let's say, that 1% of Kenyans get COVID-19, we are about 47 million, isn't it?
Yes.
That means about 500,000 people will get COVID.
True, 470,000 to be precise.
Now we have about 550,000 beds in all the hospitals in Kenya. Where are those people going to be hospitalized? And if the cost of COVID, when you're talking of mild COVID, is 300,000, who is going to pay for that? Can our budget accommodate that as a country?
But what our budget can accommodate are the preventative measures.
Yes. Actually, prevention is better than cure. We ought to be talking of how do we prevent COVID.
Which brings me to my next question, Harris.
Yes.
What you say chimes well, sounds good to the ear, pleasant to listen to, but how many people have access to this information that you're giving us? If you weren't on radio, if the insurance industry didn't focus its advertisements in the newspapers, which very few people read, how on earth would the common mwananchi arrive at this information?
I think people are trying to talk about it. You see a lot of adverts in radio, in the TV, and in billboards. They are trying to tell people, but people are very casual about it. Most people are very casual, even those who ought not to be casual. Because if you go to the drinking places and what, especially before the bars were closed, people continued with their lives. Actually, people don't take it seriously. If you see most people have a mask, they put it on their chin, isn't it?
It's true people don't take it seriously, but I would argue they don't take it seriously in comparison to what else. Because, you see, when you talk about illnesses in a setting like ours, believe me, it's put on a table and compared with other needs that somebody has.
Very true.
And care-seeking behavior is very rarely a priority.
Yes.
Yes. Unless you feel you're about to die, people very rarely seek help. They will tend to self-medicate.
Now, they ought to be told that this thing can kill you.
Actually, this is where I was going with this, Harris. I was trying to say that perhaps the insurance industry could join this fight in having this preventative approach and asking how best they can keep communicating not only their services, and the benefits of their services through the agents who come to talk to you, to sell you insurance, but perhaps begin introducing these same things in schools. I always start with schools when people are young, so that these are things they get to know and understand and grow with. So it's not something that springs on you when you start working, but it's something you've understood from an early age.
I totally agree. That's true.
I'm just thinking about the operations of many of the insurance companies that we have in the country.
Yes.
And if I was just to ask, what percentage of the population has taken up medical insurance policy?
A very low percentage.
And
you probably would put it just like, it's people who are employed, the employer gives them insurance.
Yep.
And some individuals have insurance. I would put it probably maybe a million families.
Mm-hmm.
Yes.
So 1 million families have taken up a medical insurance policy.
Have insurance.
Have
some
insurance.
Form of insurance. And these are statistics that I am drawing from the top of my head, but that's about what you would say.
So what would you attribute this to?
One, because we have mechanisms of how we deal with our challenges. Because if relatives fall sick, people raise money and they pay for it and so on.
Yep.
Secondly, perhaps economically where we are.
Mm-hmm.
Not many people can afford insurance.
Okay.
And then thirdly, some people just don't care. They think, I'm healthy, I'll not fall sick.
Okay.
Because you find people who can afford insurance and they still don't have insurance.
The common thread in all this, Harris, is information and awareness.
Yes.
And it sounds to me that the sector, the insurance industry, starting from the regulator to the players in the sector, have not taken this as one of the key important aspects of their business. You want the people who come and take insurance, you price it exorbitantly high, and that's why the other people who are not able to afford this, if somebody does not have is not employed, where the employer is contributing to this, they will not take it for themselves because it's exorbitantly priced. So you've priced it out of the ordinary person. You have not communicated the importance of taking up insurance and the benefits of taking up insurance, and you've also not communicated also to the community the importance of taking up insurance. So that's why it's not that people do not take insurance because, but people are going to do a harambe for me. No. People know that at least there's a harambe. There's one form of insurance as a harambe, but if they had an alternative, they would take it up. What has the insurance industry done to spread awareness about the insurance and their products?
Eric, there are adverts all the time. There are agents out there selling insurance to people. And let me just take you back a little. Remember where I said the insurance industry is collecting about 40 billion?
Yep.
And collectively, they made a loss of 1 billion shillings.
Yep.
So the issue of exorbitantly priced is actually not the truth, because going to a hospital is very expensive.
Yeah.
And a lot of insurance companies are making losses. And let's even talk of NHIF. NHIF, you can get NHIF with 6,000 shillings a month. And you will get some form of cover that if you go to a mission hospital or a public hospital, you will not be charged.
Yeah.
Very few people have taken it up. They have about 7.5 members, 7.5 million members.
Yeah.
And a lot of the members are those people who are formally employed.
Mm-hmm.
But the volunteers who have taken up that cover are very few.
Mm-hmm.
So the challenge we have, and I agree probably, the insurance industry, the regulator, the government and schools and everyone should speak more about insurance so that people understand and take it up.
Yeah.
It ought to be done. And if you remember, there is the agenda, I think it's Agenda 4, it's one of the pillars, isn't it?
The big four.
The Big Four, yes.
Universal health coverage.
Yeah. And I think the only place where there's been an uptick on it is in Makueni.
Mm-hmm.
Even villagers have a card which they go and they get treatment.
Yeah.
But most of the country, people haven't taken it up.
Yeah. Which brings me back
Yes.
to the industry themselves and the kind of products and innovation of products. I strongly feel that there's room for insurance companies to come up with innovative ways of selling products. For instance, why do I have to take an annual insurance? Why not monthly insurance? Why can't I pay daily? What?
You can pay monthly. There are products where you can pay per month.
And how many
There are
people
players
know
like-
the existence of these products?
How many insurance companies have monthly products, and how many people know about this?
Harris, what we're saying is that it looks like the insurance industry has tailored their products to a certain class of people in the country. And it isn't the majority. We're saying that the majority of people in this country who need health care do not get served by the insurance industry.
I believe there's room for improvement. And yes, I agree with you. We ought to improve. And especially COVID has brought a lot of things for us to realize that we are not prepared. I agree that we ought to do more, yes.
And then when it comes to now, for example, the way you're saying, addressing a pandemic like this one, and
Yes.
there's the conversation that happens within the association where majority of the insurance companies have come together and they've formed the Association of Kenya Insurers.
Yes.
On the other hand, there is the regulator who is an appendage of the government, and this is the Insurance Regulatory Authority.
Yes.
The kind of conversations that we have seen happen in this sector with COVID-19, like you said, initially, AKI came together and said, look, this is a pandemic, and therefore, under the pandemic, because it cuts across universally, all the contracts that we've given out from our companies say pandemic we shall not cover, so therefore we shall not cover. A couple of days later, the regulator comes out and says, you know what, you guys, we strongly advise that you consider a way of helping. The conversations that we've seen happening, in your own honest assessment, have they happened in a way that would address an emergency in such a way that we're saying, look, we don't know what's happening, but one thing that we know for sure is that our people, our members will need some sort of support, and this is, if we sit down, you've got the best brains. The insurance sector has got the best brains in terms of actuaries. If we sit down and just did our math, this is the kind of support we could offer immediately if the government committed to offering this kind of support. Did we see that conversation happening?
It happened, and it is still happening. Negotiations are going on. And that is why I'm saying some insurers now you see are saying we are going to cover to this level. Mm-hmm. And they have agreed that you go to the government facility and we will pay for that.
Okay.
So, but I agree that the speed that conversation is going and the action is not as fast as it should be. But remember also, everybody is being very cautious, because even if, let's take for example where the more developed world, they also have a crisis. They are not responding. And our economy, let's be very honest, it is a very small economy.
Yeah.
And that is why even you find the government appealing to the people who donate to us or give us loans and saying, help us. But they also have a crisis and they have something on their plate. They are not able to help much.
True.
So this is what I would say. Number one, I agree, government, insurance, hospitals, health professionals, and everybody should try and pull together. And this is not a time to think profits, but see how do we deal with this crisis. Because if you think about this crisis, it's like how big COVID is that our children have been at home from March.
They're going to lose a full year.
Yes, hotels are closed. People have lost work.
Yep.
And when they lose work, remember what happens. It means that the premiums that were being paid to the insurance industry
have dried up as well. Yeah, true.
Have dried up, so they don't have money. So when you say the insurance industry they are also bearing losses.
True.
They are losing customers because those organizations that are laying off people are not going to pay those premiums.
It's concerted effort. Harris, we'll be taking a break shortly, but before we go to a break, Alan is calling in from Nairobi and he's got a question or comment for you. Alan, good morning.
Yes. Good morning. I think the big elephant in the house, my brother,
yes,
is the cost. I mean, that guy is doling out figures about what it costs to do. We need to find out what is contained in that cost. Is it an ICU bed? I mean, the truth of the matter is insurance and hospitals, have come together to make just medical the cost, to drive the medical costs too high. Why should a COVID? That's the question you should be asking. Why should a COVID patient cost what? I mean, those figures those guys were doling out. They don't end up. Is it an ICU bed or what is it? And even in terms of drugs, what drugs are they taking, right? So that's the first thing we should and there's a big problem happening right now, Mr. Latif.
Yeah.
Today, if you fall sick and you're looking for a hospital bed in Nairobi, you will not get it. It has happened to a friend of mine who ended up dying in Machakos.
Yeah.
Because he had gone all throughout Nairobi. Now, one of the reasons why that is happening is hospitals don't want to admit COVID patients. One, because they don't have the systems capacities to manage the spread.
Yeah.
And two, this issue of insurance.
Yeah.
Because most guys coming up there may not be able to pay, and they don't. So when you go, you see that story of Papa Shirandula that the video was talking about.
Yeah.
The truth of the matter is, hospitals are not willing to take up this COVID patients.
True. So, and Alan, I think what you're raising is actually a very strong point. And every time we raise the question of the cost, it all comes back down to, and I don't know if you heard when we speak to the CEO of Nairobi Hospital or the chairman of the Private Hospitals Association or even the government, this cost, for example, 21,000 shillings per day per patient is because of the PPEs, because everybody who's attending to you has got to wear PPEs, and then they're just one off and you have to discard them. So this is basically bringing the cost to very high.
No, but listen, Eric. Even the people, what I need, the costs should be interrogated, because even
each
those
item.
PPEs, for each item, even those PPEs, somebody tells you PPEs and they cost 10,000 shillings, right? What goes into the cost? I think that's one of the things. But insurance companies, HMOs, and there's so much corruption involved on insurance.
Yeah.
You know, one of the reasons in the beginning of this crisis, people were not going to hostels, and one of the reasons that people were saying is they fear catching COVID.
Yeah.
But the big issue was insurance. Yeah.
Because whether you're covered.
Yeah, people just go to hospitals. When you're covered, you just take your family, let's go for a check.
Yeah.
When you're covered. But now that they knew that going to hospital can be a problem, people stop going to whatever.
Good point,
we must discuss insurance and the cost of insurance and the cost of medical. Even outside COVID, we really need to go back there.
And that's why we have Harris this morning to speak with us. Thank you very much, Alan, for the genuine concerns. And Harris, you've heard that. We're going to discuss those issues that Alan is raising. Plus, I'm seeing very many comments also coming in on social media. Spice FM KE on Facebook, YouTube, and Twitter. The issue is insurance service providers in the country, the health management organizations and hospitals in the country, and the cost of healthcare in Kenya. What exactly is happening and what needs to be done? The insurance industry globally is very, very clear that when it comes to pandemic, we are not quick to accept liability because of the cost associated and also because
the nature of a pandemic.
You don't know what it's going to cost you to provide a service to
so
your
you
members.
actually can't figure out what you should even charge.
Yeah. And then there is the issue of what has happened in this country. So once this was declared a pandemic globally, local insurance industry said so. Automatically, we are therefore not able to cover.
But Eric, what seems to be coming out even in social media is that there is a general mistrust that people seem to have for the insurance industry.
Indeed. Harris, let me just read a couple of comments here on social media for you to get this.
Please do.
MK says, lack of awareness is not the issue, Eric and CT. The insurance experience in Kenya is an expensive and painful affair, particularly in private hospitals. Somebody else says, the speaker is saying that we shall not cover when we cannot make a profit. Insurance is tailored to make a profit for the insurer. They don't want to take risks. For cancer treatment, for example, they tell you to contribute for 2 years before they can start paying for medical bills. I have emails. So see, the kind of feeling that people have about the insurance sector, the insurance industry.
It is not a love experience.
And
No,
yet,
it isn't.
And yet this should be your partners. That's why you're taking up the insurance policy, so that in the event that these people shall stand by you.
That is true. Now, as I speak, I want to say that please remember that we are also human.
Yeah.
And this pandemic is also affecting us personally, because we also have relatives and we also ourselves can get sick, and there are people in the industry who are falling sick.
Yeah.
Now, the caller who last called, Alan, I'm really sorry what happened, because what happened is because he exactly described that hospitals are not accepting patients because in some cases they don't have the space.
Yeah.
Because the place is full.
Yeah.
Or because also perhaps the patient does not have the money to pay.
Yeah.
And so they ask them go to the public facility. And so, and he also said that, he said something which that hospitals and insurance are profiting from this.
It appears.
Is that what I?
Yeah.
Yes, you heard him quite correctly. That's his perspective, yes.
Honestly, everyone is overwhelmed by it. And I do not know of anybody who is profiting from it. And it's difficult for people to believe that, but it is true. When you look at those numbers that we are talking about, and I think, Eric, you mentioned how much it costs, it is an overwhelming cost. And like we had talked, that we need to actually think more of prevention, not treating. Because the cost of treatment is just something we cannot afford as an industry, an insurance industry, or government, or as individuals.
But also realistically, it's inevitable that we will have to treat a certain number in our population.
Yes.
It's inevitable. I mean, this is a fact that we also have to deal with.
Yes. And what now, because it's important we find a solution, because if we play the blame game, we don't move forward. For me, I feel that, and this is my opinion. It's not an industrial opinion or government. I'm talking as Harris Muiruri.
Yeah. Is
that the insurance industry, government, and also well-wishers, because even companies are affected, and each of us is work together to dealing with this problem. It is not a time for anybody to think profit. It is survival. We are all on survival mode.
Yeah.
So anybody who probably is making money out of this, probably we need to appeal to them and say, look, can you lower these costs? Because the truth of the matter, it is something which can actually kill our economy.
Is it possible, Harris, to have a proper audit or interrogation of the costs? Because we are talking about, for example, in public, when the government says it's costing us 21,000 shillings to treat a COVID patient per day.
Per day, yes.
And this is there's no cost of medication, because there's very little medication that's being given to many of the patients.
Yes.
It is only the cost of accommodation and then the cost of the PPEs. Is it possible, even if we talk about the private hospitals where this now almost goes to double, is it possible for an open discussion where we say this is what it's costing, and we can clearly see it's a cost of purchase which has directly been transferred to the patient?
More importantly, is that the only cost? And can you actually audit and give evidence that this is as low as it can possibly get, and that there are no other alternatives?
That's an excellent idea. I think it should be done. I agree. Because if the cost of 21,400 per day, we need to look at it and say, can we get it cheaper?
Yeah.
Because if we don't, it will kill all of us. But this is not the time to pass blame. Even you as a press, you need to talk about COVID and tell people this thing is alive. You need to be careful. All of us need to chip in to find a solution.
And we do this, and that's why we have this kind of conversations all the time, because our role as well is to ask the questions. So when, for example, we speak to the Private Hospitals Association and the members of the private hospitals, they also talk about these high costs. And they talk about the difficulty of accessing the supply chain, where because it's a global pandemic, everybody's having difficulty, for example, getting the N95 masks. And where you come to get them, there are cartels who have infiltrated the market, and therefore the costs have gone up. So what is the best way? And why I keep bringing this up is I would have expected some sort of leadership from the players, especially the Association of Kenya Insurers, the regulator, the Private Hospitals Association, the government, saying one of you or two or three of the people, not you. I mean, I understand that you are running your own private business, but the people in those leadership positions to come together and say, let's find a solution that works best for our people. If it's about insurance companies, this is the best we can do.
I agree, and that ought to be done, and I know those conversations are being held.
Okay.
And it is a difficult conversation because somebody has gone and probably procured equipment from wherever in the world, because remember, everybody in the world needs these things. So the costs have gone up.
Yeah.
So they've brought them into the country. It has cost them so much. And they want to put a markup. That's a discussion that you say, this is not the time to do that. Can you sell this can you sell it a little cheaper? And I believe people are human, they will do it. It's one of those very difficult conversations we have to have with every stakeholder involved, whether it's hospitals, whether it's doctors, whether it's insurance companies, whether it's government, and everybody, because this is not the time for profit.
True.
We are on survival mode. As I say, this is a health tsunami.
Yeah. We'll also, by the way, we also must talk about that time for profit and the kind of profit that the players
because it's
go
immoral.
for.
Let's be honest. It would be immoral for you to be profiting
when it's
at
about a
this
life
point,
and death
really?
situation.
Yes.
But health and seeking medical assistance is a life and death situation all the time.
Yes.
Harris, tell me, in your opinion, has the insurance industry ever bothered with the rural folk in our country, people whose livelihood is derived from working or functioning in the rural areas? I say this because our rural areas still contain the largest part of our population.
Indeed. Before you answer that, Harris, let's also hear from Paul, who's calling in from Mombasa. Paul, good morning.
Good morning to you.
You've got a question for Harris Muiruri.
Yes, it's not a question, it's just a comment. I like Harris. Harris is a true example of an insurance person, where even in the discussion, he's agreeing to almost everything. And he's saying that, yes, we ought to do, yet these are things they know very well. These are things people have raised. For example, you go to a hospital with an insurance card and someone else goes to pay cash, the cost will totally be different. The person with cash will be charged less. The person with the card will be charged more. And hospitals, especially these big hospitals, will really run to the people with the cards, because I don't know whether they find it cheap money or whatever. I don't know. I'm a big friend of mine who happens to be in the pharmacy section, and they tell me that anyone with an insurance card will be given even those drugs that they don't need, so that they don't expire on the shelves.
Wow.
Because they know that will be paid. And they don't question, the people even themselves don't question those, whatever they've been given, because it's kind of free.
Yeah.
Kenyans, once you have a card, you think it's
insurance that's paying, not you.
It's not me, it's insurance that's paying. So they'll be given even drugs they don't need just to clear their shelves, you see. And I think insurance knows this, because this is not happening on another planet.
So you think there's collusion?
Here. There is collusion somewhere, and the doctors know.
Let me ask, but where would the collusion on the part of the insurance companies be? Because what you're suggesting is loss-making for the insurance company. Because if someone is being charged for something that they don't need, then it means money is being spent by the insurance company for something that they shouldn't have spent money on. So why would they collude to lose money?
There is collusion in this sense. Kenya is a it's a very interesting country to live in, whereby it's man eat man society. You see, people who are employed in the insurance company, they are employed. They don't take that to be their own.
Yep.
They think it's an employment. I'm here to eat and live. That's a Kenyan mentality, which is a very wrong mentality. So the people who are supposed to be watching over some of those pilferages in their own companies are the ones who are making deals.
Oh, so collusion by staff, not collusion by the industry itself. Okay.
By the staff.
Get your point.
Yeah.
When
Can I answer?
as you answer that, Mwenda Kisilu also says on Twitter, unfortunately, there are a number of people in the insurance companies who also have shares in private hospitals.
basically what the gentleman who has just talked and the one who has tweeted,
Yep.
we are talking about corruption. And it is true that there's a lot of fraud and a lot of self-profiting, so to speak,
Yeah.
that people want to profit from people's illnesses. And so somebody goes to hospital and the bill is made to be higher so that the pharmacist can make money and the doctor can make money and so on and so forth. So like any part of the economy, we have that challenge that there is a lot of fraud going on, and hence that is why a lot of insurance companies are making losses. And of course, there is also the whole issue of people feeling that because I have an insurance card, let me go to the hospital and get checked. And in some cases, I know people go and get perfumes and other things, and it's said it's a drug. So there is fraud. Yes, I agree.
Okay. So this is a case of
it is
fraud.
a challenge. Yes, and that is not. I mean, it's not the insurance industry benefited. We are making losses.
We are speaking with Harris Muiruri, who's joining us on the line. Harris is the managing director of Swiftlife Insurance, talking about medical insurance this morning. Harris, before we went to the break, C.T. Muga had asked you what the insurance industry has done and has been doing to reach out and cover people in the rural areas.
Now, several players actually do have county insurance where you can pay up to a premium of about 10,000 shillings for a cover of 100 or 200,000. So different players actually do have insurance where they have branches all over the country, and people are taking it up. It's slow, but people are taking up the insurance.
So how much would the premium be
For
such
you can
products?
You can get a premium of about 10,000-15,000 shillings for a cover of about 200,000-300,000 worth of cover.
Right.
Yes.
And you're saying that the uptake of this has been slow so far.
Yes, like you say, the industry is also treated. People are still fairly suspicious about insurance. Yes.
Harris, I would argue they are more suspicious of the costs.
What
15,000
cost are you
shillings is
talking
a
about?
lot of money for most Kenyans when you consider that very many don't even earn that amount of money.
So because you're talking about more than 1,000 shillings a month.
Yes.
Although I guess
That's true.
it's the issue of the communication for me, because I think if somebody imagines that they are covered to the tune of 300,000 shillings for them and their family, and then they would pay 1,000 shillings thereabouts per month, you can even start having a conversation. I'm sure if there was a higher uptake, maybe even this premium may come down.
Perhaps I could also say, like the NHIF, there is the voluntary cover, which you pay about
500.
6,000 shillings a year, and you're covered in government and mission hospitals. But that also, a lot of people have not taken it up. So I could agree with you that we probably need to be there needs to be a little more effort in getting the public to take up the products.
Actually, it's creativity, Harris, because you see, the market clearly exists. People need this product.
Yes.
But if the people who are supposed to be the players in this particular industry, if their attitude doesn't seem to take into consideration innovation that would help them benefit from the numbers, then what it says is that they are happy with what they already have, or also conversely, they're not really very concerned about that particular market.
It's a period of banking before equity.
Yes.
And the mindset
I
of
agree,
the
yes.
people in the industry.
Yes, and that's a challenge that we probably need to take up and do it.
Yeah.
Yes.
Harris, we need to have this conversation once again in coming days,
Yes.
talking about generally all insurance and insurance policies, and even creating awareness and educating people on the importance of insurance and how insurance works and the thinking behind insurance companies. We'll invite you once again to speak to us. I hope you'll accept our invitation.
Yes, I will. Yes, I will.
Yeah.
But as we finish, can I say something?
Yes.
Yes.
Please let us follow the protocols given by government. Prevention is better than cure. And I can assure you that there are many people who are having sleepless nights trying to find solutions within the insurance industry, within government, within hospitals. Not everybody is heartless. And I'm praying that we'll be able to find a solution which we will tackle this pandemic that we currently have.
Thank you very much, Harris Muiruri, the MD of Swiftlife Insurance. We wish you a lovely weekend.
Thank you.